everyone, my name is Dr. Rachel Issaka and I'm a gastroenterologist and a health services researcher at the Fred Hutchinson Cancer Center and the University of Washington in Seattle. Thank you so much for joining the AGA in this year's Advocacy Day. There are several topics that you will all collectively discuss today, and one of them is support for research at the NIH. Here are some talking points to help guide you in that discussion. So one of the issues at hand is that President Trump's fiscal year 26 budget has proposed to cut the NIH by approximately 40%. A cut of this size would cripple GI researchers and would have particularly deleterious effects on those who are early career investigators. So what's the solution? We are asking Congress to allocate $51.3 billion to the NIH. This is the amount of money that is required to keep up with biomedical research. Another topic that's good for you to know is that since last Congress, there have been discussions over potential restructuring at the NIH. The President's fiscal year 26 budget contained language that would consolidate the 27 NIH institutes into 8. This would result in even more competition for research dollars for digestive and gastrointestinal health. The Secretary of Health and Human Services has broad authority to restructure the NIH without congressional approval. But here's where your expertise comes in. We all know the importance of having these dedicated institutes that fund research specific to those organ and disease states. And so here's where you can convene or share a story about why this restructuring would be harmful to digestive health research. So what should you tell your congressional representatives or their staffers? First, that federal funding for the NIH generates significant economic activity. So for example, in fiscal year 24, NIH funding supported nearly 408,000 jobs and generated close to $95 billion in economic activity. This is significant return on investment for the funding that comes from NIH research. And this is why investing in NIH research is key to keeping the US competitive on a global scale. We are asking that Congress allocates $51.3 billion for fiscal year 26 to fund research at the NIH. And again, here's where if you have a story about how recent cuts in research funding, delays, or terminations have affected you, a colleague, or patients you care for, this is the opportunity to share. Thank you again for coming, and I hope you have a fantastic day.